right, well, out of respect for everybody's time, I am going to go ahead and get things started. It is straight up 7 o'clock. There will be people who continue to join, and that's okay. I first just want to welcome you to our second installment of our 2020 Science on Screen from Salina Art Center. We are really happy to have you with us. This has been a learning experience for us, as so many things in 2020 have been, because we have had to switch gears, even on Science on Screen, so many times, from our initial plan in April, when we should have done National Science on Screen Night and all of the things that we had along with it, to where we are tonight, which is, we hope you went and saw the film over the weekend while it was in the cinema, and now you're joining us for this virtual conversation. Science on Screen is a national program intended to really spark interest in those STEM careers. So this idea of taking a film, which is America's favorite pastime, and striking up a conversation about the scientific elements that may have loosely been related to that film. Last week, we had a great conversation about wind and solar energy after watching the film Tesla. Tonight, we're going to talk about sociopathic behavior and kind of what that means and what that is and how maybe that related to the film KAJILLIONAIRE. And next week, we encourage you to watch your favorite spider film and then join us with Dr. Justin Jones from the University of Utah, Utah State University. I always say University of Utah. Utah State University. He is the director of the Spider Lab, and he will be talking to us about how they are using spider silk to do all sorts of amazing technological feats, from creating medical tendons and things that can be replaced in the human body to Kevlar vests. But I think for me, the most interesting part of the entire conversation is how they actually get enough spider silk, which surprisingly is not from spiders. So tune in next week to figure out what animal is actually producing spider silk, which I think is the most fascinating part of the conversation. So Science on Screen is funded through the Sloan Foundation and the Coolidge Corner Theatre, and locally from Kansas Bakers Technologies. And so we are very, very happy to have that funding and to do this each year. And for all of you who are joining us on this virtual adventure as we try it during COVID times. So I am happy to introduce tonight's special guest speakers, Dr. George Jerkovich and Dr. Paula Fried, who are going to take us through what are some of the behaviors that we maybe saw in the film, or what does this mean? So I'm going to turn it over to them now. And as you have questions in the night, you are welcome to use the chat feature, or you can unmute yourself and ask questions when it's time. And we want this to be a participatory event, so please feel free to participate in the conversation. So I'll turn it over to our speakers.
Well, Paula, I really didn't have any formal prepared comments, except to say that I guess the short answer, in my opinion, is yes, they are sociopaths. And but the film was just so disturbing on just several different levels. And what was most disturbing was how they treated their daughter. This total lack of empathy with their own child. What are your thoughts?
Well, I agree, George, that as I said earlier, I just sort of had a knot in my stomach the whole time watching this film, even while I was admiring a lot about the craft of the filmmaking and the way the story unfolded, and kind of kept me in suspense as to how it was really going to play out. But I will agree with George that we didn't really prepare comments, and that we really wanted to have a good conversation with all of you about this, and hope that we can weave in the science of antisocial personality disorder as we talk. But so if anyone wants to start off with a question, or we have some questions to get us started, but maybe I'll first just put it right out there. Does anybody have a question that is just really on their mind that they'd like to get us going with? Kristen.
I think you just answered it. In terms of a diagnosis, sociopath is not standard diagnosis now, is it?
That's correct.
And so you just said what the words are. What is that?
Antisocial personality disorder. And George, do you remember the history of when we moved to antisocial personality disorder?
I don't remember specifically, but the term, the oldest term is psychopath, followed by sociopath, which is still used, but the official diagnosis is antisocial personality disorder, which, and let me first define what a personality disorder is. It's a certain character structure and a certain way of behaving that is pervasive and is not the result of some other underlying mental illness or drug and alcohol abuse. And typically people with antisocial personality disorder, somewhat artificially, you have to be 18 years old to get that diagnosis. You can't be diagnosed with that magically before age 18, but the good news is that you have to have had conduct disorder as a child and have that before you have before you get to, that's part of the diagnostic criteria. So it is and also the issue of personality disorder also has a stable, observable types of behavior that are consistent across time and across population groups. It also has with it associated family history, genetics, things of this nature. So,
And we contrast that to things like anxiety or depression, which tend to come and go more for people. As George was saying, the personality disorders are seen as like really kind of solid character structure that is hard to change. Not impossible, but difficult to change. And my sense, George, and you have to tell me if you think of it this way too, is that we moved away from terms like sociopathy to anti-personality disorder to try and, in a little more humane way, not reduce the person to their disorder. Like a sociopath sort of describes the whole person in terms of their personality, that personality structure, whereas antisocial personality disorder suggests they have a disorder rather than that's the whole sum of them. It might be hair splitting in this case.
yeah, that's true. And I think as, as understanding goes on, the terms change, but usually in mental health, terms are used too frequently and they're considered to be pejorative, so the terms are changed. For example, right. I mean, idiot and imbecile used to be technical terms,
right?
Back in the 19th century. So yes. So now we've moved to antisocial personality disorder to try to more humanely describe this troubling condition, which I might add is not troubling to the people who have it.
Well,
that's the key thing about.
We have a question in the chat from Serena, and she says, what exactly is the diagnostic criteria? And can you have a disorder with no genetic history of mental health in your family?
Well, I would say, I would have to actually look them up, but actually I should.
George, I have a list. I have a list right here, George.
Oh, perfect.
One cheat sheet for us. As George said, you have to have been diagnosed with a conduct disorder by the time you were 15, which means you were already having a lot of trouble conforming and behaving well. The other criteria, you have to have 4 of these traits: unable to sustain consistent work, doesn't conform to social norms, including unlawful behavior, whether they've been arrested or not, disregards the truth as indicated by repeated lying, conning, using aliases, impulsivity or failure to plan ahead, move around a lot without a goal, irritable and aggressive, recklessly disregards the safety of others, consistently irresponsible, as indicated by repeated failure to sustain consistent work behavior, lacks remorse and feels justified in having hurt, mistreated, or stolen from another, and difficulty staying monogamy for more than 1 year. Anything I left out, George, that comes to mind?
It's not a diagnostic criteria, but there's a really massive lack of empathy. I mean, as would be for other people, as would be suggested in that. But to the other question is, yes, you can have a disorder without any family history or a genetic history. And I don't want to overplay the whole role of genetics, because practically every person that I've seen that has sociopathy or antisocial personality disorder, and say their diagnoses on the chart, have usually had really substantial histories of trauma and substance abuse, and just a lot of other complicating factors. I just thought I'd throw that in there.
I really agree with that. Such an important point. People just don't randomly end up this way. You know,
Yeah.
you have to have had a particular set of experiences that.
Yeah, I think it's definitely nature and nurture here.
Mm-hmm. Right. That's a good way of saying it.
Can I, on that thought, as I was watching the movie and trying to understand the family of three, at points I could understand that it was working to some extent, the dynamic. But on the other hand, I found myself constantly wondering, for each of them, why are you still in this web? Why don't you just walk away? You seem to have capacity to make a lot of decisions and to be rather clever. And then I'm wondering, am I just being judgmental and I don't understand that this system is a viable way to go through life?
I think that's a great question. I'm curious what other people think. Was that your sense too, that why did people stay? Why did the three of them continue to participate in this? Anybody have a thought about that? Mary, are you trying to talk to us? You're muted still.
Someone
There you
said,
go.
Can you hear me now?
Yes.
yes.
I think the system gets locked in. There's a saying that we used a lot in discussing family systems, you know, what's known as the norm, and change is fearful. So families get locked into these various roles. And from the outside looking in, you say, well, why would you want to stay like that? But when you're inside it, you're sort of locked in in terms of your response and how you're feeling. And
this is, I'm sorry, just to interrupt. This is an irrelevant point, but I think that's my photograph of Prague above you, isn't it?
Oh, yes, it is.
Okay.
Can you guys hear me?
Yes, Cerise.
I was gonna say, like she just said, but going off on that more. I haven't seen the movie, but I think I'm gonna get it on tonight on my Amazon. Is it worth it, you guys?
It's hard to watch, but it is good.
Okay. So I was going to say about being the three looking from the outside looking in. It's the repetitiveness, but it's also the safety of doing what the person, what they know. If they get outside of that, their mental illness will just maybe succumb them, and safety, whether that feels the same to someone has those tendencies, they still want to do what feels most comfortable
and familiar. I think
and
that's
familiar.
a good point. One thing that I thought was fascinating is that the mom, Deborah Winger, seemed to have a real connection to her husband, even though she had none to her child. And I'm curious, did it look that way to anyone else? Or
Yeah,
do you think she was just, go ahead.
No, I was struck the fact that the two of them seemed to have a bond between them, but clearly used their child as a pawn, as somebody that they exploited. Which it also kind of struck me that, you know, the character Old Dolio, it's a great name, to me seemed kind of peculiar. I mean, you know, she never changed her clothes, and she had kind of peculiar posturing. Her voice was odd. And I kind of wondered, you know, because the parents in the movie looked like they were in their 60s and they had her late. And, you know, especially fathers who have children, father children at a later age have about a 50% higher risk of having an autistic child. And I kind of wondered if that character was on the spectrum, which would also make it harder for that person to break away or have the capacity to break away out of that system. That was just speculation.
Well, right. And so that's the nature part that I think that's great. You brought that point up, but just from the nurture point of view, she had just grown up in the weirdest circumstances possible.
Yes.
You know, and so for her to imagine, I mean, could you picture her, Kristen, forging out on her own? I mean, she was street smart, but.
Right. I just could not, I didn't know from where she would have had any modeling about a capacity to feel feelings. And she seemed to have strong feelings for this other woman. And you saw that developing throughout the movie. And I just wondered how realistic that would be. She had to, the parents did confirm that they were not going to change and things would be the same, and she knew what that would look like if I get my third back. And she was going to change things. She had decided, okay, I have my third and I'm going to do something else. I just don't know how she could do that.
Yeah.
I'm glad she did.
I was rooting for that too. Sydney, what do you think?
Well, in many ways, I don't think the marriage in this situation is different from most marriages. Almost all marriages. in that you just grow and continue to move on with the personalities. And so many of us just kind of zig and zag through the life together and make accommodations as we need to. So really, I didn't think of them as she wanted to, in the hot tub scene, she wanted him to be happy. And although that's not probably the norm anyway, there are ways that we all accommodate our marriages and partnerships in similar ways. So I did not find that part to be so unusual.
That's a great observation. I mean, probably to all of us, it seemed like clearly the person who it wasn't working well for was the daughter. Somehow the husband and wife, they had collaborated, right, to create this odd arrangement, but the daughter really didn't have a vote. She was just, you know, sort of collateral damage to what was going on there. One thought I had, I'm curious how this looked to the rest of you, but it seemed like the father was just sort of indifferent to the daughter. I mean, just saw her in a transactional way, however she could help with the next scam. But I felt like the mom was actually sort of hostile toward her. Did you think that?
Yeah, I think that's a good point. The mother seemed to have a certain amount of meanness towards her daughter, whereas the father, as you said, was indifferent and was, which is the kind of indifference that you would expect from a sociopath, in that they're indifferent and kind of use the person for their, for the next, in this case, for the next scam. But yeah, I think, I don't know, what do other people think? Do you see the kind of hostility that, or feel that the mother had some hostility towards her daughter?
I did see quite a difference, but I was wondering at some points if the mother thought she was actually helping and preparing her daughter to be strong and to be independent, though of course she was not the least bit independent. But the thing about putting the baby on the belly versus the cot was just very interesting to me. And she just kind of dismissed cot, she just said, well, of course we put you on the cot. And again, that was another time when I wondered how Well, I guess the daughter did visually see a child approaching the breast shortly after birth. So maybe, but that really seemed to move something in her. And that puzzled me also, because I don't know to what she would reference that kind of tenderness or natural instinct to be cared for.
Yeah. Because I think we're led to believe her parents never held her or hugged her or cuddled her, or so there was something really powerful for her in seeing that. Cerise, did you want to say something?
Oh, well, I didn't, but I'll ask what I put on the chat.
Oh, good.
I asked for you and George as practitioners, if you ever see or have read about this kind of behavior where that is really the way the person appears on the outside. They appear to have all those tendencies, yet when allowed to dig deeper, they actually do have empathy somewhere in there. They have the ability to live more normally. And if so, how do practitioners get to that if they see that that's a possibility?
That's a good question. Well, you know, I think when we say, you know, for example, that sociopaths lack empathy, it's not that black and white. I mean, you know, there's gradations, and there would be some people who have sociopathy who have more insight and perhaps more empathy than, or, you know, with narcissism or other personality disorders, have more or less. But I think a key thing, I don't know, Paula, if you could comment on this. Typically, people with sociopathy don't show up, or at least they don't cross my path because they're upset about being sociopaths. I mean, what happens is they've gotten caught, jail time is being threatened. They're more prone to depression and more prone to substance abuse. So, you know, there maybe was an intoxication and some impulsive suicide attempts, so they ended up on the inpatient unit. I mean, it's that kind of interaction that I'll usually have with that sort of patient, but they don't come in calmly and say, you know, I have sociopathy, I'm troubled by my lack of empathy and my disturbed relationships, and I want to change things. I don't know, Paul, what's been your experience?
Well, same, and I'm probably even more removed from that than you are, George, in my, you know, private practice where people completely are there voluntarily. More often I might run into a spouse who comes in, and over time it, you know, begins to look like their partner has antisocial personality disorder. So I more see it that way, and oftentimes isn't interested in coming to therapy with them. So that would, I agree. But you know, we do know, Cerise, to your question, that the brain is enormously plastic, and even late in life, it's possible to create new neural architecture and new thoughts and behaviors, but someone has to be really motivated to do that hard work. And, you know, as George has indicated, people with antisocial personality disorder don't usually think it's a problem. You know, it's only if someone else insists that it's a problem, like the law, or, you know, maybe a spouse.
Yeah, and then when the law or the spouse does insist, then they still don't feel it's their fault.
Right.
Yeah.
Another comment in the chat, someone asks, isn't the lack of empathy more about the want of control?
I'm sorry, could you repeat that, please?
Isn't the lack of empathy more about want of control?
Like a defensive reaction to feeling out of control or not having control. I wonder if that's what the question is. So like,
I don't know, maybe she'll chat some more with us and we'll get some more, because okay. So we'll let Candy chat with us a little bit more, maybe explain that question better. And I have another question that came in privately that asked, studies show that young males, particularly males of color, have a tendency to be disciplined more in public school situations. Since a conduct issue is often a precursor to an antisocial personality disorder, do we see that males or persons of color more often diagnosed than others?
Well, I would say that, I know this is more an opinion. It's not based on, it's more based on my clinical experience. I would say that males in general are more likely to be diagnosed with antisocial personality disorder. I think there probably are some, I don't know that, I think if there's a greater amount proportionally of sociopathy in, say, African Americans or people of color, I think that's more likely an effect of socioeconomic issues and maybe institutional racism than any real biological tendency like that. Plus, I mean, from a scientific biological point of view, I mean, race is totally a social, is a social construct. It's not really something that has any biological predictive characteristic.
I'm so glad you said that so clearly, George. And there is data that shows, even starting in preschool, that Black children, Black boys especially, are labeled as more aggressive or more violent, even when there's sort of objective data that refute
Right.
that. I mean, we really do just have some enormous biases in our systems that have trained us all to think certain ways, look for certain behaviors that are very problematic.
Yeah, I mean, we see that with adults. I mean, that young white man who shot all those people in the church is being escorted out in a bulletproof vest, and people get blacks just get killed for no real reason. So I mean, we even see that. I mean, it's an aspect of our society that can't be ignored.
Right.
I wanted to ask George and Paula if you're familiar with the works of Dr. Stanton Samanow. I went to several of his workshops. He wrote a definitive book and workbooks in his work with the prison population called Inside the Criminal Mind. Great emphasis on the antisocial personalities that are incarcerated. And the focus is on not getting into deep expressive therapies, but more addressing their ways of thinking. Because if they see that it's worth their while to look at something differently than they had been using their entire life and doing their behaviors, it had a pretty good effect on them. He's quite known in the field. Are you familiar with Dr. Samanow's work?
Well, I personally am not. I don't work with that population, but I think it makes sense that what he's decided is that, or what he's shown to be effective is to kind of let them figure out what's in it for them to change. And that seems like a very sound way to approach it.
He had quite a detailed workbook, and we were able to use some of it in our treatment program in terms of just looking at, not that we had that many prisoners, but we had people who had that mindset. And so it was a helpful way to help them look at how they viewed their world and how they acted as a result of that. And maybe it was worth their while to try something different. It's a real interesting book to read.
It seems like a very pragmatic way to approach it, rather than try to get them to feel sorry for what they've done.
Absolutely.
In a way, it's like making the psychotherapy process transactional. Like,
yes,
I can get you something, you can utilize me for how I might be able to be helpful to you. Yeah.
Good point.
So more, I guess, more in the chat, and going back to Candy's original question about empathy and control. So she put in some more here. So isn't the lack of empathy more about the want of control? people who lack empathy often lack it because they want control of those around them. They choose control rather than empathy. Is that a common practice, or is that something you would agree with? Is control and empathy possibly linked?
Well, I don't know, Paula, I really haven't thought of it that way, but what's your thought about this linkage or potential linkage?
Well, I can imagine, especially from like the antisocial personality disorder perspective, if what you're really after is trying to manipulate people or control them to get what you want, being empathetic would be a big distraction, right? It would really get in the way of you being able to, utilize others. So I can imagine, I guess I can see the link that Candy's suggesting here, that there's sort of an over focus on controlling other people rather than any effort to understand people.
It isn't often like, especially in cults, showing that you understand someone, showing that you know how they feel, you've walked in their shoes, is a way to ultimately have control over them.
Well, and we saw that in the movie, right? Like this really tearful speech at dinner that Dad makes about how we've really done it wrong. We thought we were doing right by you, and then we learn, spoiler alert, Cerise, we learned that was all just part of the scam, but in the moment we weren't sure. Did you wonder?
Oh, I did.
Yeah.
I did. Yes.
Yeah.
Yeah, I thought the parents were kind of likable in the sense that they were sort of anti-heroes, but then after that last scam, they were beyond redemption.
Yeah.
Yeah.
What did you all think of that at the end? Were you shocked that it played out that way, or did you see it coming?
Well, Paula, I was a little bit surprised because I guess I'm hopeful that people can make change for the better, and this sort of crashed any hope of that. And so it was very disappointing.
Mm-hmm.
Okay, we have a very risque question in our chat, which I almost hesitate to ask, and you are welcome to not answer if you choose. I don't want to hijack our entire conversation.
Mm-hmm.
Since we seem to be getting a little quiet, I will ask. Does Donald Trump exhibit antisocial personality characteristics?
We prepared for this question. We assumed that would be asked. George, take it away.
Well, I think that, there are journalists who have written, there's a recent book about Trump being a sociopath. I think that my formulation of him, and Paul and I talked about this briefly, that there's one of the differences, and actually this came from an article in Psychology Today, because I really hadn't thought of it that way, but I think it's a valid point that one of the differences between a sociopath and a narcissist is that a narcissist has a lot of ego invested in it and doesn't have kind of a callous indifference, because a narcissist needs to be admired. And I think that there is no question that the chief executive has an insatiable need for admiration. So I would say that there's clearly some narcissistic tendencies again, I would say, in my opinion, I have never actually sat down and spoken with him, and I don't want to use my title as a psychiatrist as having any special knowledge of him. There was a case with Barry Goldwater where a bunch of psychiatrists got sued for coming out against him and saying bad things about him. So I don't want to say bad things, but I think that we see in the media some clear signs of some narcissistic tendencies. And in the course of that, there have been things that some might consider sociopathic, for example, the university and, some other skullduggery, which we probably don't know about, but may be revealed in the future.
And I do think that the narcissist is more vulnerable because they can be manipulated, that because of their ego needs, the need for admiration. And, and I mean, I have the sense that there are people who know how to get Trump to do what they want by playing to his ego. Whereas a sociopath, someone with antisocial personality disorder, is much more immune to that because they're always, 10 steps ahead, anticipating the next scam.
In the chat, somebody asks, is it difficult to see the difference between a covert narcissist and a sociopath?
I would say it's more challenging.
Yeah. They have a lot of shared characteristics, like that sort of sense of entitlement, being above the rules. They can be smart and charming, and, so there can definitely be some shared traits.
Yeah, and usually, I mean, the type of sociopath that comes into contact with the law is probably more likely to be poor, more likely to be uneducated, and probably not very charming, and maybe not as smart.
Mm-hmm.
But your smart, charming sociopath, educated, these are captains of industry.
Committing different kinds of crimes.
Well, not necessarily crimes. I mean, just because something's immoral doesn't mean it's illegal.
Okay.
So we're not talking about necessarily criminal behavior, but that's just my prejudice here. I'm just.
No, that's a good distinction.
There was another question from Salina Hernandez I saw pop up.
Actually, she said that we just answered her question.
Oh, okay.
They were very similar. So I'm looking through my private chat here because I have a few private questions to see. How do sociopaths, okay, let's see if I can understand it. How do sociopaths sort of dehumanize their victims? How is that lack of understanding other people? How does that even exist, I guess, is what she's saying.
How does it exist?
Yeah. Like, how did the parents not recognize what they were doing? Like, as a mother, how do you not recognize what's happening to your child?
Well, I don't think it's like an intentional strategy. I think it's about the deficit that was in the mother. Like we can only speculate about whatever her trauma history was, right? That she had such a sort of hostile, connection. I mean, I don't think we'd even call it attachment to her daughter, and somehow having not formed a connection to her from the very beginning, because of her own, we can only speculate, history. I think. Go ahead, George.
No, I think that a quote, whatever a normal person would be, if they saw that they were doing that, they might be troubled and try to make some changes or try to get some help to make some changes. But the fact that they don't have that capacity, I think, removes some of the intentional meanness out of it. But it's this lack of, it's really a lack of capacity to see that.
Mm-hmm.
Now, another interesting take on antisocial behavior. For example, people who study sociopathy, I remember talking about sociopathy as a adaptive gene dispersal mechanism, because people basically get mad at sociopaths and kick them out of their tribe, and so they go someplace else and procreate. And the animal model for that was with wolves, but that's kind of far flung from this discussion. But I think I thought it was an interesting point, thinking of sociopathy as a gene dispersal mechanism, and that's why it kind of persists. But the other reason it persists is if there is any genetic underpinning to it, these men are not monogamous and they're pretty busy. So.
Uh-huh. Well, I was trying to, in my own mind, imagine what kind of history the mom could have that could account for her inability to care about her daughter. And so, of course, the first thing that comes to mind for us mental health professionals is wondering about her early childhood experiences, what kind of family life she was born into. But another sort of later life, I mean, I'm assuming there already would be some obviously antisocial personality traits, but if getting pregnant with old Olio somehow really changed the dynamic with the husband, so that, like, from a truly sort of transactional point of view, the mother saw her life as now diminished, like old Olio's birth cost her something in terms of her marriage, that could perhaps affect her inability to feel any care or concern or empathy for her. But I don't think it's anything that someone works at. Like, I don't think it's a strategy. I think it's like an absence.
Mm-hmm.
Is that how you would
And
say?
then, she probably had the child as an older woman. And maybe, it could have been one of these accidental things, and, she might resent the daughter.
Right.
Another chat question. You mentioned conduct disorder in childhood. What if a child was not diagnosed? Is it then that the adult would not be diagnosed since they were not diagnosed in childhood, perhaps only recognized by those around them?
What you typically do in these situations is when you do a psychiatric history, you take a history of their childhood also. So even though they might not have been formally diagnosed as conduct disorder, if you get enough evidence from the patient and from, say, family members, you can make that, you can say that they had that as a child, even though they were not diagnosed as a child. So you can retrospectively come to a diagnosis. But I would wonder if someone was perfectly well adjusted as a child, and then as a young adult started manifesting antisocial behavior and was getting in problems with the law and all that, my tendency would be to more think about something like substance abuse or an underlying mood disorder, or is this pre-morbid for what will ultimately become schizophrenia? That would be my line of thinking, as opposed to, say, I would be more I would think less likely to make the diagnosis of antisocial personality if there really wasn't anything as a child.
Just to underscore George's point, because usually these people have like really notable histories as adolescents, and young children, cruelty to animals, setting fires, abusive to other kids, shoplifting. I mean, they, like George said, they haven't had model lives, and then all of a sudden become antisocial. I'd agree with your formulation. Something else would seem to be afoot there.
Yeah, I would worry about other things.
Mm-hmm.
How common is it? This is another chat question. How common is it that two sociopaths would find each other as these characters did? Or I suppose one step further, are there certain characteristics or even mental health conditions possibly that would match up better with sociopaths? Codependence in a way, or
like if we were going to set them up on a date, who would be the ideal? Yeah, that is a great question.
Well, I mean, if I were to set up a male sociopath, I would find a woman who's had strong dependency needs, and probably had an alcoholic as a father and was physically abused or maybe sexually abused. I mean, they would get along great with this.
Tragic.
That's not, I don't mean to laugh, but this is just this is the kind of patterns we see. It's not funny at all.
No, right.
But
I think it's an interesting question about the movie. Like, is that realistic that two sociopaths would work so well together?
yeah.
I think that is stretching it a little bit.
Yeah, I think a point we need to make about this is a movie.
Yeah.
This isn't a documentary on sociopathy. So this is a movie, so there's some artistic license. I found the least consistent thing was this bond and what I thought was some level of affection that the husband and wife had for each other, and they kind of worked together as a team. That that to me was not typical.
I was wondering if anybody, trained or otherwise, would want to comment on the relationship between the younger woman who kind of joined this group momentarily and her mother. What was going on there? Her mother was always buying two of the things and they were always on the phone. And that was a relationship that was curious to me also.
Yeah, what do other people think? I think that's a really interesting question. Anybody have any sense of that? I mean, they clearly had, we might call it a fused relationship, you know, like they seemed to talk all the time. And one of the reviews that I read said that we had the hint that there was something very troubling in that young woman's life, but we didn't know what it was. And certainly her delight in joining this trio of criminals was a little hard to understand. She was adventure seeking, but yeah, I wasn't quite sure what to make of that.
Well, I think in some way it maybe to me contrasted the type of relationship that she had with her mother versus the type of relationship that old Olio had with her parents. So I suspect
the sense that the daughter in that case was taking care of the mother. She seemed kind of annoyed by the intrusions and was always trying to calm her mom down.
Yeah. So that caretaking role was something she'd kind of been trained up in and could easily fall into with old Olio.
Sydney, do you have a question?
I have a question about the bubbles. Was it like a soap factory that they were living next to? And I loved when I guess they were on the plane trip, that they had fashioned this like thing that was supposed to contain the bubbles in some, it was a platform of some kind. I just thought that was so brilliant as a filmmaker or the writer or whoever, because it was just so quirky, and they would come in and wipe those bubbles down. Didn't they even set their watches or something to
structure their day
around those bubbles?
Yeah.
I've just never seen anything like that in a movie that was so wed to the whole idea of who these people were and the situation they were in.
So if we thought of it as a metaphor, I think that I'm trying to think where to go with it. I mean, in a way, it was sort of symbolic of this, of the transactional nature of their life. I mean, they're just things that they did, and that it didn't matter whether they had any meaning or purpose. It was just kind of what's the next thing. And some of those were, I mean, most of the next thing were trying to get something off somebody, but I guess it made just as much sense for them to have the next thing after that be scooping up bubbles before they, I mean, their life wasn't organized around the normal relationships or connections that any of us have.
But I think another need for that was that movie was so depressing that you needed these comic relief situations just to ease the pain of watching the film and make it palatable. So so a lot of the quirkiness in the film, I think, was also there to just offset some of the darkness.
Well, Sydney had kind of alluded to this in terms of a relationship and accommodations that are made along the way. And all of us need to be aware of the accumulation of things that we now call normal. Okay, well, this is the normal. And I really think at $500 a week or a month or whatever it was, that this was just something that they set their watches to, because this was part of being able to have that space to live in. And yeah, it is good to step back and say, now, wait a minute, is this really meeting my goals in a reasonable fashion?
like asking all the time, to what have we accommodated? I think that's a great way of putting it. One other clever comment I saw in a review, you know, the crazy kind of limbo game they played whenever they passed in front of where the landlord might be, and how the parents bent forward, but old Olio had an amazing flexibility in her back, you know, and went backwards. And one of the reviews I read said that by the end of the movie, she wasn't willing to bend over backwards for anyone anymore. And I thought that was a great
And
line.
the landlord had issues of his own. And that was, you know, they just sort of touched on that. But then I guess that makes sense that that kind of group would pair up to be landlord and renter, you know.
Yeah, it was
Yeah,
really
they were,
independent.
yeah, they were so manipulative of him and just so inconsiderate, which is par for the course.
But he knew he was having them live in substandard conditions, you know, and having to take care of the bubbles, you know. I mean, it was a real codependent pairing.
Okay, it looks like we might have one more chat question. So you have mentioned substance abuse and depression, but do narcissists or sociopaths have a higher chance of having mental health disorders such as schizophrenia or vice versa?
Well, I think, let's see, there's certain things that sociopaths might be more likely to have because, to some extent, because of their behaviors. For example, if you're getting into fights and get into thrill-seeking behavior, you're more likely to get a head injury. So you're more likely perhaps to have traumatic brain injury, a seizure disorder, some of the affective instability that comes with that. In addition to chronic substance abuse, you know, you can develop chronic psychotic symptoms, which might look like schizophrenia. I think as far as I know, the only clearly definitive risk is increased depression and increased substance abuse. I would be surprised if they had an increase in bipolar affective disorder, but you know, perhaps they do. But they will have you know, the sequelae of you know, the effects of substance abuse, effects of traumatic brain injury. So I don't know if that's, I mean, I would have to really give a good answer to this. I'd have to do some exhaustive review of the literature, but that's kind of what my general impression would be.
All right. Are there any last questions? It looks like Cerise.
Yeah. Going back to what George was saying about captains of industry would tend to have sociopathic tendencies. I've read that also, but it seems to me like the most successful person who does have those tendencies, as you say, often they're very, very smart and charming, understands that they should act a certain way to people, and they pretend to have empathy and caring and all that stuff. And those kinds of people with antisocial personality disorder, they don't get in trouble because they're smart enough to be aware to pretend, so nobody really can figure out what they're really like. Let's say if they have a kid out in public, they pretend that they're empathetic and kind and caring and loving, and then at home, you know, they're just regular. Do you think that's kind of true in terms of people who seemingly have the tendencies but are in fact very, very successful and never have any problems?
Well, I think almost, you know, anyone has a persona which is public and one perhaps somewhat different one that's private. You would hope that those not be radically different. Yes, no, I think a sociopath would be a smart one would know that if they behaved more empathically, that might get them further in life. That's similar to some of what was alluded to with working with the criminal mind. You know, getting them to understand that certain behaviors are better than others. So yes, I think that's a possibility.
Yeah, that rings true to me too.
We just never know what's going on in the human mind. That's really what you're saying, right?
Right,
Yeah.
right.
But you know, one thing, this is kind of at the end of it. I am part of what makes my job interesting is that I'm always, you know, I hear stories of people's lives and I just wonder, how could this happen? And, you know, I'm frequently reflect to myself, you couldn't make this stuff up. And that happens a lot. And, you know, I wouldn't be surprised if there is a couple living behind a soap factory somewhere scooping bubbles. I mean, it's not beyond comprehension.
All right. Well, thank you, Dr. Jerkovich and Dr. Fried, for joining us and having this conversation with us tonight following the film KAJILLIONAIRE. We really appreciate your time. Again, I'll remind everybody, go ahead and register for the Spider conversation we will be having next Monday night at 7 o'clock. You can register online on our website or on our Facebook page. And it'll be the same type of format where hopefully we will just have another great conversation on these very complex topics, but hopefully in a very light and palatable way. So thank you all for your time. We appreciate you very much. And I hope we see you back here next week.
Okay.
Thanks for all the great questions and comments.
Thanks, everyone.
Yeah, it was a lot of fun.
It's great. Good night.